Do you frequently feel like your heart aches sometimes, even when the doctor says your heart is fine? Or maybe you wake up every morning, but it feels like a heavy weight is on your chest. You're not lazy, you're not weak. That deep exhaustion, sadness, or emptiness could be a sign of Major Depressive Disorder, or MDD. MDD isn't just being sad for a few days. It's a real health condition that affects how you feel, how you think, and how you live each day. Imagine the volume of your joy being turned all the way down. Colors seem dull, food tastes bland, and even your favorite shows don't make you smile. This isn't something you can just snap out of. It's like having a broken app in your brain that controls your mood. But the good news is, it can be fixed with help. Think of your brain like a high-tech radio that plays the mood station. Sometimes the signal gets weak, or the wiring gets a bit fuzzy. MDD happens because of a mix of things, not just one cause. Genes might play a role. If a parent had depression, you might be more at risk, like inheriting curly hair, but for brain chemistry. Life events are strong triggers too. Losing a loved one, a breakup, job stress, or bullying can overload your emotional system. Even your body matters. Poor sleep, lack of sunlight, hello winter blues, or long-term pain can contribute. It's like a chain, one link breaks and others follow. And no, it's not about being too sensitive. It's about real changes in brain chemicals like serotonin, which help you feel balanced and calm. How do you know if it's more than just a sad phase? Let's play a quick game. Pick the statements that sound like you. Honestly is okay here. I feel tired, even after sleeping 8 hours. I've lost interest in hanging out with friends or hobbies I used to love. Eating too much or too little feels normal now. I keep thinking I'm useless or nothing matters. I've had thoughts about not wanting to be here anymore. If 2 or more fit for over 2 weeks, it might be MDD. Other signs, trouble focusing, like your brain buffering all the time, feeling restless or slowed down, or crying over small things. Real example, Maya loved painting, but now her brushes collect dust. She says, "It's not that I don't want to, I just can't feel the spark." That's MDD changing lives quietly. Diagnosing MDD isn't a blood test. It's more like emotional detective work. A doctor or therapist will ask about your mood, sleep, energy, and thoughts, not to judge, but to understand. They use a checklist, like the DSM-5, to see if your symptoms match MDD. No shame here. It's like taking your car to a mechanic when the check engine light glows. Treatment, it's not one size fits all. Talk therapy, like CBT, teaches you to challenge negative thoughts. Imagine catching yourself thinking, "I'm a failure," and replying, "Wait, I paid my bills and made my bed." That's not failure. Medicines like antidepressants help fix brain chemical imbalances. It's not a happy pill, but more like oil for a rusty engine. For many, a combo of therapy and medication works best. And no, meds don't change who you are. They help you feel like yourself again. Can you prevent MDD? Not always, like you can't always avoid catching a cold, but you can build strong emotional immunity. Start with small habits. Daily walks, sunlight, and movement equal natural mood boosters, staying connected with at least one person you trust, and getting regular sleep. Imagine your mental health like a phone battery. If you keep it charged with rest, joy, and support, it won't die as fast. Practice self-kindness. Would you yell at a friend for feeling down? No, then don't do it to yourself. Also, recognize early signs. If sadness lasts more than 2 weeks and affects your work or relationships, reach out. Prevention isn't about never feeling sad. It's about having tools so sadness doesn't turn into a long storm. Science is making hopeful moves. One big advance, ketamine-based drugs like Spravato that can reduce severe depression in hours, not weeks, helpful for those who don't respond to regular meds. It's like a quick reset button for the brain, though it's used under medical care. Another cool area, brain imaging and AI helping tailor treatments. Imagine a test that says, Your brain type responds best to therapy A or Med B, personal medicine for the mind. Also, research is digging into gut health and depression. Your stomach bacteria might talk to your brain. Probiotics or specific diets may one day support mental health. Hope is growing, and so is help.